I truly thought I was a goner. I had so much pain in my chest, and it just felt like there was something trapped in my rib cage. I could hardly breathe. At first I was sure it was just the effects from the surgery I just had, or the anesthesia, or maybe the pain meds I was taking. I just hoped it would just go away, and soon.
The nurses left me alone in the intensive care unit holding my wife's hand, and I kept thinking, how could this happen to a woman, and at such a young age? And why didn't we know that everything could be so different just because she was a woman? What would happen with our baby?
I was seriously injured when I was hit by a car about a year ago. A driver was texting, of course. So I went to the emergency room, and x-rays showed that I broke the bone in my left leg, and just below the knee, something called a lateral tibial plateau fracture. Anyways, they said I would have to have surgery to set the bones. And unfortunately, it took a few days to find an orthopedic surgeon that would take my health plan. So, of course, I was nervous. It was my first surgery, and I was pretty bored because I was just restricted to my bed. So I decided to search around the web for some info about my upcoming procedure. And I didn't really understand everything I read, but something about the risk of blood clots in ortho patients and how they could be easily prevented. And I remember, though, that the health information site said that aspirin alone was not considered a prophylaxis, which means it would not be strong enough to get rid of my blood clot after a surgery. So I told my doctor that of everything, I was most concerned about the clots. And he told me not to worry, that I was young, and he was gonna give me aspirin. And so I did question that, but he assured me that he knew what he was doing. And a couple days after the surgery, I went back home, and I started experiencing swelling and bluish discoloration of the skin on my leg, and just bad cramps. And I just figured it was normal after all the trauma the leg had been going through. But the next morning, an incredible pain shot at my leg, and I didn't think much of it initially. Unfortunately, the pain persisted and worsened. Nothing relieved it, not the medicine or changing positions, not even lying down. So I went back to the hospital, and sure enough, I had a pulmonary embolism. And I admit I didn't take the aspirin after leaving the hospital. I was nauseous from the anesthesia, and aspirin just made it worse. But who knows if that would have worked anyway. I wish I had known.
I found my wife, Lindsay, sitting on our bed, sweating profusely and extremely nauseous. She said she felt sick, really sick, like it was the worst flu that she'd ever had in her life. So I took her to the emergency room. 3 hours later, they sent us home with a prescription for nausea. I think they took one look at her, saw that she was young and fit, and immediately dismissed any possibility of a heart attack. Now, the next morning, her symptoms were even worse, so we went back to the ER. One doctor wanted to do an EKG, which basically didn't show anything unusual, but fortunately, they had also done some blood tests, and sure enough, Lindsay had had a heart attack. But why? How? She didn't have any chest pain. There were no sudden severe symptoms, and what caused it? She did have gestational diabetes during the late stages of pregnancy, and I know she was supposed to follow up with her doctor, but she was busy being a new mom. Could that have had anything to do with this? A few months ago, my father had to be hospitalized with several bouts of angina, and I started to read what chest pain and heart attack patients were saying online in blogs and forums, just trying to find out what he should do to mitigate the pain and avoid the big one. But nobody ever talked about the specific risks for women, or that a woman's clinical presentation could be so radically different. We just didn't have a clue. I pray the stent they're putting in works. I wish I had fought harder for more aggressive treatment for her symptoms at the very beginning. I wish I had been more knowledgeable that the symptoms and the presentation could be so different. I think about it all the time. I just wish I'd known. An informed and engaged patient or consumer can have a tremendous impact on our healthcare system. Making patients aware of their risks, helping them understand symptoms, especially symptoms that may be unique or different, having them adhere to treatments and follow up with necessary care, and enabling them to be engaged in their own health and well-being can truly impact costs, access, and outcomes. The problem is that millions of American adults are not even able to read a pamphlet or words on a website, and even those who can read only remember about 10% of what they read after a few days. As a result, nearly half of U.S. adults have trouble understanding and acting upon health information. To make the transition from empowered to educated, healthcare consumers must improve health literacy beyond the content of a 30-second commercial, a brief paragraph on a website, or posting on a blog. Video and audio have the ability to increase the comprehension and retention factor by 5 times or more. Effective education motivates patients to consult with doctors, pursue appropriate treatment, and comply with treatment regimens. Creating and supporting informed, proactive consumers is the right strategy at the right time. The educated patient will result in significant differences for physicians and hospitals, while potentially providing game-changing opportunities for organizations like yours. Innovative, high-impact education and marketing programs can connect healthcare organizations and pharmaceutical companies with today's healthcare consumer. And cohesive patient education or communications programs can align brand goals with patient needs. CRM brings the right media mix, reaching patients and consumers on their turf. Objective, patient-directed information that is more comprehensive to truly impact learning and behavior change, and bottom-line results. We're your patient education and direct-to-consumer communications partner.
I wish I had known.